Hi, everybody. I'm Dr. Amy Barron. Welcome to Talking Away the Taboo. We are thrilled today to bring you a special edition of this this wonderful series. We are today bringing on Dr. Veronique Berman and Dr. Romy Shulman from Chana UK, which is the fertility organization for the Jewish community in the United Kingdom. And we're thrilled to have them. So I'm just going to grab them here. Hold on. Okay, they should be here any moment. So today we're going to be talking about the holiday of Purim is coming up later this week, and this is typically a very triggering time for so many different people. And so what we're going to do today is talk to the experts, talk to them and get tips and suggestions about what we can do, what we can say, how we can be helpful, how other people can be helpful, and really bring some sense of comfort and bring some sense of comfort and support to a space that is very typically really, really difficult. So, Dr. Shulman and Dr. Berman, are you there?
Yes, I'm here. Can you hear me?
I cannot, in fact. We are having technological difficulties. I heard her, but she wasn't there. So come join again and we will grab you. And then we're going to start. We're also going to learn a little bit more just about what Chana offers. There are different services, there are programs, because while the Jewish community in the UK is, smaller than in some other parts of the world, we know that the Jewish community is very large, and we often know people who live in different areas in different countries. And so it's important to know about the resources that exist in all the different areas so that we can better help our friends, our neighbors, our family members, etc. So just join again, and we will start in a moment. Hold on, let me see if I can grab them as well. Give me a second. Just hold on, guys, hold on. Okay, let's see. Okay, if anybody has any questions, please let us know. They should be joining us momentarily. Again, this is a special Purim edition of I Was Supposed to Have a Baby's Talking Away the Taboo series. And we are just waiting for one moment to get the amazing people from Chana on here so that they can join us so that we can get this started. I urge everyone in the meantime, we're going to be having lots of different questions and different content, both in our stories and as part of the content that we're putting out this week. We're also going to be offering our own suggestions, our own tips, our own thoughts about how to make it through. This is commonly a very, this is commonly a very triggering time for people because Purim is a holiday that unable to join. Here we go again. Guys, it's happening again. Let me try one more time. Let's see if we can grab them. Let's see. I know you're here. I know you're here. I'm just waiting for you to come. Okay, so, and they're here. Excellent. Okay, thank God. We got it. Okay.
Sorry, that was a little bit tricky, but I'm here.
Okay, all good. All good. Dr. Shulman, it's so nice to see you. Is Dr. Berman joining you on the same screen, or she's joining on a different screen?
She should be joining on a different screen. I hope that she will be here soon.
Okay, in the meantime, let's get started. So please, Dr. Berman, please introduce yourself, your role at Chana, and then we'll launch right into our topic. Go ahead.
Okay. I am Dr. Romy Shulman. And just before I start, thank you so much for hosting us to have this very important discussion with you. I am an existential psychologist, and I am also the clinical lead at Chana. So my role at Chana is to oversee all the emotional support services that we offer. And I meet all the new couples or new clients that come to us. I get to know them a little bit, and I put together a bespoke package of care for them with one of our support workers, and we offer support with medical information, emotional support, and also financial support. And because we have such a big team of 17 therapists, we have a lot of different options that suit a lot of different situations and personalities.
Okay, perfect. I want to talk all about that, and we are going to get to that later on. But I know what top of mind for people, really what top of mind for people is right now is the holiday of Purim. Purim is coming up on Wednesday night and Thursday. It's a full day holiday, and it's a time, as we all know, it's a time when even if you've been hiding in your house that you're ashamed of your diagnosis, or you're just don't want to see people because you're too worried about what someone might say to you, you don't really have that option on Purim because of its obligations. You have to go out. One of the commandments in the holiday of Purim is that you have to actually hear publicly the reading of the story of Esther, the story of the Megillah. And so you have to see people. There are the, one of the other pieces is this idea, and I think Dr. Berman is joining us in a second, is this idea about giving gifts to friends. And so you have to see people and give them gifts. And then there's this other big meal, this festive meal. How can someone who's struggling with infertility even begin to think about this holiday without having a massive meltdown? Let's just call it what it is.
Okay. So you're absolutely right. I think Purim, I think all of the holidays actually in their own way can be really difficult for couples who are trying to conceive. And actually every day can be really difficult in different ways. There are triggers all around us. The triggers are different for different people. And when you're waiting desperately to have a child, or you're going through fertility treatment, or even if you've sadly lost a child or a baby or a pregnancy, these days are going to be difficult. And I think Purim, especially because of the heightened happiness and simcha all around us, and this mitzvah of increasing our simcha and happiness on the day and in the month of Adar, I think it kind of widens the gap between people who are going through suffering and what looks like everybody else out there that might be, I think when we're going through a hard time, when we look around, it's easy. It seems like everyone else's lives are just going on as normal. And on a day like Purim, I think the gap feels much, much wider. So
true.
And a few things, I have a few things in mind to talk about tonight, about some of the choices actually that we do have in the ways that we can connect to Purim. And I'd like to discuss that a little bit. I think one of the reasons Purim is so difficult is that there is a huge focus on children. And really, when we think about it, the essence of Purim is not really anything to do with children, but it's become
so
that
true.
with the dressing up and the mishloach manot, and it's become very child-centered. But actually, the story of Purim is such a beautiful story about triumph over difficulty, and such a strong woman who really triumphed over adversity. And it's a shame to not, to let the opportunity pass of actually connecting to the essence of the day that can be done in a very positive way. And I'm sort of listening to you saying, you have to go to seuda, and you have to go out of the house, and we have to hear megilla. And there are a lot of have-tos that we do. They are mitzvot, and if you are that way inclined, so yes, these are the things we have to do. But there are actually lots of choices in the way that we can go about that. And I think it's really important to remember the choices that, for couples to remember the choices that they do have. Because so many choices are actually taken away, to really use the choices that they have to celebrate Purim in the way that actually would work for them.
I love that, because you're 1,000% right. The whole essence of going through fertility struggles to trying to have a child, and the doctor's telling you have to do this and you have to try that and you have to that. It's the very essence of choice being taken away from you. And you just beautifully elucidating this now about how really, there are choices about Purim. So tell us a little bit
Okay.
more.
So first and foremost, I think, the main mitzvah of Megillah is to hear every single word. And really, that is best done when there are not lots of screaming children in the room. And it can be really helpful for someone to seek out, maybe a later Megillah reading either for professionals who've come home, later from work, or whoever might need that later reading, and to go to a reading that's more adult focused, and where the focus is more on the story and sort of sitting there to hear the Megillah and to connect to the mitzvah. I don't know how it is over there, but over here they're often also very, quieter Megillah readings in people's homes, and sometimes can be really helpful to just get in touch and see what's out there. Maybe there might be some options that feel more comfortable to go to in a smaller environment, maybe somebody and hear the Megillah that way, rather than needing to go to, the hustle and bustle of shul, which really might feel very difficult.
I love that. Right. Like it's not about the big scene. It's about hearing the words, and you can choose places or scenes, or you can choose friends who have that smaller intimate gathering where there isn't so much craziness that you might feel triggered by. I love that. It's an excellent idea.
So I think that could be useful. And I think, the joy of any special time is experienced in so many different ways. It's through the food we eat, through the clothes we wear, through the activities we get involved in. And although there are kind of the prescriptive activities of Purim Day, it doesn't have to be that way. So what I would recommend is for everybody to have a think about what are the things, connect to the things that actually make you happy on a personal level. I know for me, that would be a really good cup of coffee, and maybe, a treat that I've baked or something like that. I know it's not the same for everyone, but just to prepare something, an opportunity or something that's going to give you happiness on a personal level, and to connect to the happiness of the day in that way. You don't really have to go anywhere, if that's your way. And I think that there are lots of different ways of connecting like that. I know, you mentioned Mishnah not being difficult for some people. For other people, someone who feels really creative and connects to it in that way might really enjoy that. But I think also to really highlight what you said, that it doesn't have to be like an obligation to give, everybody on a huge scale. Maybe more to give one or two people, perhaps to, who've been there with you on your journey, or just people that are really, special to you, and get involved, enjoy the happiness of doing that, if it feels that way for some. And I'm very cautious, because one thing I've learned as a therapist is that every person's journey is so different. And what's really painful for one person can be really comforting for another. And I'm totally aware of that. But I think it's about choosing on a personal level what connects and what feels good. And that's really what it's about.
Absolutely. I will say personally that we as a family, my husband and I, made a decision that the holiday was too stressful. And this was even like in the midst of our fertility journey, and even afterwards, that the holiday became so stressful, trying to match one for one. You gave me a gift, then I have to give you, then I feel bad that you didn't give me. And like this whole nine yards, this whole, it was a lot of guilt on top of all of the other things that we were feeling. We made a decision as a family that we give out like basically less than 5 mishloach manos, sometimes even only 2, because the candy and the nosh that is given out, nobody needs. Yeah. And it's really just for the people who really need it in their lives, who, like, people who are marginalized in our community, someone who's single, someone who's disabled, someone who doesn't have a lot of friends, is newer to the community. Those are the people that need something and want to feel like they're included. And those are the people that we've chosen to give to. Everyone else, they know they're not getting anything from us.
That sounds perfect. And, I think that's definitely the better way to go about it. It all kind of spirals otherwise. Yeah.
Yes.
Sounds like you've got it right.
But I love the idea of like giving to people who've been helpful and meaningful and really supportive to you on your journey. I think that's an incredibly beautiful idea. I love it.
I think that can be good. And it kind of leads on to my next point, actually, that giving in itself intrinsically makes people, it lifts the mood. And whether that's through mishloach manot or, you know, really the most important mitzvah of Purim is matanot le'evyonim, giving to the poor. And it can be a really good way to just to lift the spirits, to sit with your spouse and think about a cause that's really important to both of you, and to select a place to give matanot le'evyonim and to get enjoyment out of that on Purim Day. You know, it's a different kind of enjoyment from, you know, the craziness that can be out there, but it's definitely uplifting and bringing happiness to the day.
Beautiful, beautiful. And then what to do about the meal? What to do about the seuda?
The big question.
Look, you knew I was going to ask, so
yeah, and I've given her plenty thoughts, so that's okay. I think that can be in some ways, you know, one of the most difficult parts. And I think, again, to remember that there is a choice in the matter. So if you're a person who feels that, you know, you want to go to a seuda and be part of that, fine. But I don't think that we're obligated. I don't think anyone's obligated to really push themselves to endure a difficult meal that's going to cause them pain and discomfort. And there are so many other ways to have a Purim seuda. So, you know, I know one couple, their thing was to prepare a really nice breakfast, do an early seuda, like a breakfast brunch, spend it together, husband and wife, really enjoy it, something really special, and then just go off and enjoy their day. And they take their seuda off the list. And really when the time for seuda comes around in the afternoon, they've done it and they're already in like a different headspace. You know, another idea is to have a really special romantic dinner at home. Make or order in your favorite foods, make it really special, and just kind of reframe it. I think it doesn't have to be this, you know, huge meals and sitting with, you know, in a place where you don't feel comfortable. But there are lots of ways to connect, you know, like a date night, and make it really special in other ways.
Amazing. You know what? It's as someone who in years past has worked on Purim, I remember being in college, like I remember a bunch of us sort of sitting around eating like corned beef sandwiches at some point during the day, and like that was our seuda, right? Yeah. And it fulfilled all of the obligations, but I had never thought about just like, it doesn't have to be this hubbub. It doesn't have to be 100 people. It can just be 2 people with candles and delicious food and just enjoying each other. So it's bring this closer and more intimate, and to make this feel a little bit more special.
Exactly. I think you summarized that really beautifully.
So tell me, so we're having difficulty, by the way, I'm just letting you know, we're having difficulty getting Dr. Berman to join for whatever reason. The technology is not working. So at some point we'll figure that out, or maybe she'll join. I'll have you go off and then she'll come on. Okay. But in general about the day, can you also give us some pointers? The rest of us, we know that there are people in our lives who don't have children yet, or we see that they have these age gaps. They've never shared anything with us, but we can presume that there might be something going on in their lives. How can we be sensitive to them on Purim, knowing that, you know, all of the craziness, as we've talked about, yes, like we will try to, like the couples themselves, the families themselves will try to do their best to, you know, try to limit their triggers and try to do the best they can in terms of managing the day's expectations. But what can we do as a community? What can we do to help support them?
So I think honestly, the answer is to treat them the same as you would treat anybody else. that is what I find most of my clients say, that they just want to feel like everybody else. They don't want to feel like there's an elephant in the room, and they just want to go on as nothing, as there isn't a problem, that nothing else is going on. And I think that we can actually do that. I think we can start to second guess ourselves when we're trying to support other people. Would they like to come to our seuda? Would it be difficult for them? And I think really, I would advise to not make those choices for the couple. Just invite, just include, just give them a mishloach manot. It's up to them. If they don't feel comfortable, they can say no. They can, it's much nicer for them to decline 5 invitations than it is for them to sit alone with no invitation.
Correct. To let them have the choice for themselves, as opposed to you deciding, you know what, it's going to be too hard for them. Excuse me, while I'm just I am fixing my phone and making sure that we are appropriate here and that we can actually continue on. It's better for them to have the choice as opposed to you presupposing for them. That's basically what you're suggesting.
I think so. And I think just feeling like everybody else is really important. When so much is up in the air, for friends and family to just remain on an even keel, and for some things to just go on as normal, I think is really comforting. And so that's what I'd say. And I would add that if these lovely couples do come to your seuda and do join you, to just be mindful of keeping the conversation adult focused. I think, it's very easy to kind of slip into comfortable conversation. And I'm sure it would be better for them not to hear, ongoing stories about children and schools and bottles and feeding and those things, which can be difficult to sit around. And there are hundreds of other things about a couple to talk about. Correct. Other than the fact that they're struggling to conceive. They might work, they might study, they might, have really interesting opinions on lots of different things. They may have been on a trip, they may be planning a trip, whatever it is, that's there's so many other things to talk about and just get on with, without necessarily asking how things are going, or which I think is a tricky one, and I think it's best to just follow their lead. If they want to share with you, to be a listening ear is always very comforting and helpful, but they might not. And if they don't, that's also okay. I think to just kind of, being a good friend is following their lead.
Absolutely. Look, we know, I mean, it's so interesting because, even as we're talking now, like, we know there are millions of topics in the world that one can talk about. And one of the things we're actually going to do this week, and we've been asked this to do before, is make a list of all the different kinds of things you could talk about that have nothing to do with children, because this list is good for different holidays. It's good for Shabbos meals. We have another holiday coming up in a month, Passover, Pesach. It's good when you're just standing around, at a bookstore, at a kiddush, or at a bar mitzvah. We all are much more interesting than our children. And so we need to make other people feel comfortable. We need lots of other things to talk about beyond like restaurants.
Yeah, and there are plenty of things. And I think everybody will enjoy a more stimulating conversation.
Correct. No one wants to have this, the umpteenth conversation about diapers. So yeah, absolutely not. Okay. So I'm going to ask you, thoughts about having, like, would you have a meal that, like, if you were the one who was doing the inviting, would you try to have a meal that included a few single couples without children, or a few singles? Or would you say, like, it's better to have like a mix? Like, what would you say? Like, to have people who are all the same, or people who are just sort of one type or of one status in life, so to speak? Like, how do you advise people when they're thinking about their inviting? And this is like not only for Purim, but this is just going forward.
Always. I think a mix is good. I think, I think it would be nice to not have only one couple who do not have any children yet at a table that are filled with families. And I think it's nice to have a balance. It's nice for everybody to have a balance, or to have a table with lots of couples who don't have children, and that's also fine. But I think just to be mindful of somebody feeling the odd one out, I guess, at a table, and to try to mix it up and make sure that everybody feels comfortable. But it does depend on the situation. Sometimes within families, that's a little bit more difficult to orchestrate. Right. But I think I think if you're being mindful and sensitive and thinking about the couple and putting their needs first, I think it's easier not to go wrong.
Look, yes, 1,000%. At the end of the day, regardless of who's around the table, it's being mindful of what the conversation is and trying to make people feel comfortable. Yes, absolutely. Okay, Dr. Berman, for whatever reason, technology is not allowing you to join. So I think we're going to choose, is she, Dr. Shulman, is she in the same location as you?
She's not in the same location as me, but I am wondering if we're both signing in possibly on behalf of Hannah, if that might be what the problem is.
So she's signing in under her own account, so it seems not to be that way.
It's not working.
Okay, so here's what we're going to do. Why don't you give us a little bit of background? I want to just shift everyone. This conversation is meant to really give everyone an appreciation for the kinds of work that Hannah does. And you can see just by hearing from Dr. Shulman right now that you can hear all the different pieces. They're incredibly thoughtful in the kinds of things that they advise and the kinds of ways that they try to help people, both themselves and the community at large, in terms of how to help and how to support. So can you tell us a little bit more just about Hannah itself and your role? And then what we'll do is we'll try to bring Dr. Berman on. We'll have you click off and try to bring Dr. Berman on and see if that will work. If not, then we'll do one other piece and we'll try to bring her on right after this. Okay. So tell us, when did you get involved with Hannah? Tell if you know a little bit of the history of Hannah, so that people can understand more of what you do.
Okay, so Hannah was started 29 years ago. We have something, I don't know the exact number today, but there are about around 830 babies that have been born with Hannah's support.
Wow.
Which is wonderful, thank God. And it's great that I don't know the exact number, because it's going up all the time, which is really lovely, thank God. And what we do is as I said a little bit in the beginning, we support on these 3 avenues. So we kind of combine this multidisciplinary approach of the emotional support, which is offered by trained therapists who are part of our team. We have 17 consultant therapists who work under our umbrella. And that goes hand in hand with medical information and support. And the way that works is we have a medical panel made up of lots of different specialists related to the fertility field: gynecologists, endocrinologists, embryologists, pharmacists, lots of different minds that sit together around one table, and they meet quarterly, and any of our clients are able to put their case to the panel. So this, if they just want like a second look at the treatment that they've been advised, or a second opinion, and they have this opportunity of these specialists really having often a really vibrant and interesting discussion about the cases, which can either be comforting to just endorse what's been suggested, or sometimes they do kind of come up with things that might have been missed, or some ideas to look into, and that to get, all of our support workers work really closely with Dr. Berman, who is our in-house scientific advisor, and she chairs this medical panel, does a really wonderful job of chairing the medical panel, and she is our link between the medical side, and she's an incredible support to our support worker team. And then once plans have been approved by the panel, we can then offer some of our couples funding towards their treatments. In England, the NHS does offer certain limited support to couples for IVF treatments. But certainly for people who've had one child or who've had cycles that have sadly not worked out, there is a cap on that, and that is where we step in as an organization.
Incredible.
Business.
Incredible. So people come to Hana, they could be coming for medical guidance. They could be coming for halachic Jewish law guidance.
Yes,
they could be coming, right, we're going to get to that. They could be coming for financial assistance, or they could be coming for emotional support. I mean, they could be coming for any of those reasons. Yes. And that is all under the umbrella of the kind of work that Hana does.
Yes, absolutely. And actually, they don't have to take all of those things at once. They can take, pick and choose. But yes, that is how we work. And thank you for raising that. Absolutely, under the halachic guidance, we have a rabbinical panel, and any treatment, anything that's done with our support, we do within halachic parameters, and we offer guidance and information on that as well.
Incredible. I mean, I'm incredibly grateful that you're here and that you're able to give over a little piece and give people support and chizuk during this time, which is so difficult and triggering for people. But in general, that Hana exists and that it has existed for so long, and that there is something that is quite vibrant and quite multifactorial, really, in the UK, and that people should know that you exist. Let's see if we can bring on Dr. Berman. I'm going to have you click off, and let's see if we can bring her on, and then we will say goodbye afterwards. But Dr. Shulman, thank you so much for your time. I am incredibly grateful for your advice and for your support. Where can people, if people wanted to reach out to you directly, where could they find you?
To Hana or to me?
To you through Hana, how would they find you?
We have a website, which is hana.org.uk, and on the website there is a facility to send us an email, which will be responded to within about 24 to 48 hours. We also run a helpline on Monday, Wednesdays, and Thursdays, and the hours and contact is on that. Is also on the website, and all of our contact details are on there. So yes, absolutely, if we can be of assistance to anybody, to give us a call or send us an email. Okay. So I'm not sure if I'm going to be back on here to say goodbye or not. It depends how the technology goes. But
we are all just trying to figure this out. Welcome to technology, everyone. Normally you can have 3 people, even 4 people on a live at once, and we've been having some technological difficulty today. So we're going to try to have Dr. Shulman come off and see if Dr. Berman can come on and tell us a little bit more about Hana. Okay. Hopefully then the 3 of you will join and we can finish this out together, but we're going to say a sort of hello and goodbye right now.
Okay. So if we don't manage, just sort of say thank you so much for hosting this and for allowing me to be part of this conversation. So thank you, and I hope I'll pop back on to say goodbye now. I'm not even sure how to get out of this. I have to work that out now.
It's welcome. See, the beautiful thing about social media, everybody, is that we have an opportunity to learn all kinds of new things, all of us, as we are doing this. So it is, and being that as I was supposed to have a baby, we have done about 70 some odd episodes at this point, and we are still learning the technology, which is
that makes phenomenal. Me feel. I see a button that says leave, so I'm going to press that now.
Excellent.
Thank
you.
We
will see you soon. Okay, hopefully. Okay, so we are really looking forward to having Dr. Berman with us as well. It has been a challenging day for technology here. If anybody has any questions, please drop them here. But I loved the fact that, let me see if I can grab her. I'm still unable to grab her, but we'll see. I might talk to myself for a little while. I really love the fact that Dr. Shulman talked to us about a number of different ways that people could really advocate for themselves in regard to this holiday. This is, as we know, it is a triggering holiday, and she made some really wonderful suggestions that I'm just going to go over very quickly as we're trying to figure this piece out. So one of the key pieces that she spoke about right towards the end was about the meal. On Purim itself, the meal, the Purim seuda, is often this like big, jolly old party with lots of people and lots of kids around, and tends to be very raucous and really pretty noisy and pretty triggering for people who are going through treatment and aren't used to explaining themselves or having lots of people around. So she made a couple of really beautiful suggestions. Number one is she said there is no obligation to have a crazy meal. The obligations are only that you have a meal. So two things she said were, two things she said. One was, she said, one couple does a really beautiful brunch in the morning, that they get all of their favorite foods, their favorite brunch foods. They sit down, they have a relaxed meal themselves in the morning. It's delicious, it's yummy, they get a chance to bond, and they don't like have to deal with all the craziness of the day. So that's one idea. Another idea is making the meal later on, dinner time, but making it more into a romantic dinner, making it like with candlelight, also like either making your favorite foods or getting some of your favorite foods, but really doing it in a way that's romantic instead of like craziness. And so I think that I'm just trying to make sure that we don't lose ourselves here. I think that um, the beauty about this day is the fact that you can choose whatever you need to choose in order to do what feels good for yourself. There are lots of have-tos during the day. You have to do the meal, and you have to go hear the megilla reading, and you have to send gifts to friends, and you have to give money to the poor. But you can do it in a way that is meaningful to you, is not triggering, and that feels comfortable for you. So that's the piece that I want to give over. That's the piece that Dr. Shulman gave over, and also Dr. Berman, who unfortunately has not been able to join us. But those are the pieces we want to give over. And Chana is an incredible organization that is based in the UK. They offer lots of different kinds of support for anyone who's struggling with any pieces of infertility. We urge you to go check them out if you're in the UK. And if you have any questions for us or any questions for Dr. Shulman or Dr. Berman, please go find them on their website. It's Chana, chanauk.org. And so I wish you all well, and may you all have a wonderful Purim. Take care. Bye-bye.